Over the past 2 years of the pandemic, it's no secret that early educators have made a superhuman effort to support the children in their care, to keep their centers' doors open, and to protect their community. But what protective measures have been most common, and which have been most effective over the course of this pandemic? That's been the focus of a new study out this month from the Yale Children and Adults Research and Early Education Study Team. The year-long study, which looked at childcare providers from all 50 states, gave us one striking headline. Childcare providers who had children aged 2 and up wear masks, starting earlier in the pandemic, closed due to the coronavirus 13% less often than those who didn't. To understand this finding and learn what it means for the millions of early educators in America, I spoke with two authors of the study, Drs. Tom Murray and Walter Gilliam. Tom is the Associate Medical Director for Infection Prevention at the Yale New Haven Children's Hospital, who specializes in pediatric infectious disease and disease prevention. Walter is a professor of child psychiatry and psychology at Yale and the director of the Edward Ziegler Center for Child Development and Social Policy. He focuses on research within early education and how that research can affect public policy. Here's what you should know about this new study and how it helps us understand the path forward for early educators in this pandemic and beyond. The study started as an effort to understand how early childhood educators were taking COVID safety measures early on in the pandemic. As Dr. Tom Murray explains, the roots of this research go back to the summer of 2020.
In this study, what we did was we surveyed early childcare providers at 2 points in time, once at the very beginning of the pandemic and once a year later. And we asked them about all the different things they were doing in their programs, like masking and symptom checking and temperature checking and distancing at both time points. And then a year later, we said, over the last year, did your childcare program close due to COVID or a COVID-like illness? And we were particularly interested in closure for reasons that we talked about before, because of the profound effect that has for both those employed by the childcare programs, but also the families that they serve. And what we found when we looked at all the different mitigation factors, one of the things that really predicted whether or not a program could stay open was whether or not the children over 2 were wearing face masks, and that led to a reduction in closures. Just to be clear, you asked, what didn't we look at? We did not specifically look at the number of cases within the program or actual transmission rates. It really was about, if you were in a program where children were masked aged 2 and over, did that program close more or less frequently than other programs where that was not the case?
To collect the data for their study, Tom, Walter, and their research team surveyed 6,654 early educators across all 50 U.S. states. Their survey didn't just look at child masking. They also asked about precautions like symptom screening, social distancing, and outdoor drop-offs, which are now muscle memory for so many early educators. In that first survey from the summer of 2020, only 9% of those survey respondents said they were asking children to wear masks. But when the team came back a year later, they found that child masking seemed to make a statistically significant impact.
So when we did the analysis, we were looking at all the different factors to see which of them contributed to preventing closure, and trying to understand how much each of them contributed. And in the analysis, and Walter is the statistical expert, so I can let him expand on this part of it, you try to make sure that you understand which of these factors really truly make a difference. And what we found, the first thing that we found is that for many of these other things, a lot more programs were doing it. So, upwards of 70% in many cases were doing things like symptom screening and staggering their pickups outside and those kinds of things that you described earlier as muscle memory. So they were much more common. But when you look at the statistics, the only thing that we found to be statistically significant was the child masking and comparing different programs who were engaged in masking versus not masking. For the other strategies, there were trends, but nothing that reached significance.
So early on, only 9% of surveyed educators said they were asking children aged 2 and up to wear masks. The other 91% said they were taking other precautions, but not child masking. But when the team sent out another survey 1 year later in the summer of 2021, they found that that small percentage of educators who had been child masking since the start of the pandemic seemed to have closed due to COVID at a rate of 13% less often than providers who hadn't been doing that. As Dr. Walter Gilliam explains, child masking works in tandem with all your other COVID precautions, but this data suggests that it makes a particularly positive difference toward protecting you from closing down.
And likewise, when we're now studying child masking, we can't completely remove all of the other context that's happening. These child care providers are doing amazing stuff. And the families, in many cases, are also trying to do things to keep their children safe. And so we can't really completely remove that, but we can try to statistically control for it. And when we statistically control for it, child masking seems to matter above and beyond all these other things taken within that context.
It's also worth knowing that this study did not ask about how well or how often children were wearing masks, only a yes or a no. So in that sense, it suggests that child masking still makes a difference even when you're not doing it perfectly.
And one of the things that I think is important to bear in mind, and I think you were hitting on this before, is, of course, not everybody's going to wear the mask correctly. And especially when you're talking about young children, and they might have to take mask breaks. And some of the times they might not be wearing it because they're eating, or the quality of the mask may vary from one program to another, or the one child to another. And so this is not a study to see how much can masks help. It's more a study looking at how much did masks seem to help in the real world, given the fact that not everybody's going to fully comply or perfectly comply with the best possible equipment. So there's a difference between an efficacy study, which says, under all the perfect conditions, did this thing really help? Versus an effectiveness study of, in real life, in imperfect conditions, in imperfect practice, did it seem to help? And we're much more of the latter on that, in terms, because we don't know that everybody was masking really well. And so when you think about it, this is in one respect, perhaps a low-end estimate of the impact of this. This is an impact of what it is in the real world, not necessarily an impact of what it could be if we did it really, really well.
Another point to note is that between the summers of 2020 and 2021, the follow-up team found that the rate of early educators who reported practicing child masking in their centers had increased significantly, from 9% of respondents up to 33%. But, as Tom explains, the findings of the study came from looking at that small minority who had been asking their children to wear masks since the very early months of the pandemic.
So we saw a significant increase in the number of programs that introduced masking over the course of that year. We were unable to look at those later on maskers because we didn't know when they started to mask during the course of the year, whether it was the day after the survey closed in 2020 or whether it was the day before we sent the follow-up survey. So because we didn't have that sense, it would have been very difficult to interpret their information if they weren't and then they started.
Again, we've got to think about these findings in the bigger context of your everyday practice in childcare. Child masking isn't the foolproof magic solution, but when done along with more commonplace precautions like distancing and outdoor drop-offs, child masking does seem to give you an extra measure of protection against closing because of COVID-19.
When we're talking about real live childcare programs in the real world, these are not in petri dishes. So everything that you're studying, regardless of what it is within the context of everything else that's going on around. And so you can't really figure out what is the impact of the entire context, but you can sometimes figure out statistically whether something contributed above and beyond everything else that was happening. And when we did the analysis that way, it doesn't necessarily tell us, whether the context itself was mattering, but it can tell us that above and beyond everything else that was happening, child masking mattered.
So if you're an early educator, what does all this mean for your day-to-day practice? Well, in short, this research suggests that you should keep child masking as one tool in your toolbox to protect yourself, your children, and your childcare center against COVID-19.
Everything in life is about risk-benefit, especially during a pandemic. And that while certainly it can be very difficult to ask children that are in this age group, this younger age group, to wear a mask all the time. It's like was said earlier, being able to do something is clearly better than being able to do nothing. And so, if the masks are available and community transmission rates are high and people are sick, it certainly seems like this is something that, even if not done perfectly, can help keep children safe and keep programs open during the pandemic. So I would encourage program directors and early childcare workers to consider it as a risk mitigation strategy, in addition to some of the other things that they're doing.
The coronavirus itself has changed over the course of this pandemic, but the precautions we take to protect ourselves against it remain the same. And as we do that, we've got to look at the big picture of protection.
And Dr. Murray likes to talk often about a layered approach, and that masks. I mean, when you have a good mask, oftentimes it's multiple layers of masking. Because multiple layers of material in there. And the reason why is if it was just one, then things get through the holes. But if you have multiple holes and multiple layers, then fewer things get in. And when you think about it in a bigger sense, then our multiple layers are, can you get the transmission rate low in your community by doing the right thing at the community level? And then can you get people vaccinated around these young children? Because right now, in the United States, we aren't vaccinating children under 5 years old. Hopefully we'll be able to do that soon. But right now, that's an unvaccinated group. And so can we at least vaccinate the adults around them, their parents, older siblings, the adults that take care of them in their childcare programs? Can we do the other types of things too that are designed to keep COVID-19 out, such as symptom check, people keeping their children home when their children are sick and not sending their children into a childcare program to perhaps infect other kids? And on top of that, as one of the other layers, perhaps consider, when transmission rates are high, having children wear masks.
All of us are anxious to put the pandemic behind us, or at least to do so as best we can. And especially within early education settings, that goal has children's well-being at its core.
To me, the most important thing, thinking about the mental health of our children and the development of our children in this age, and that's, Walter's certainly an expert on that, it's allowing the kids to be together. The lockdowns and the closures and all of those things, we can't go back there because of the effect on the mental health. So, if levels are high and kids have to wear a mask as best they can to help keep a program open and keep parents at work and keep those kids socializing, then I would argue the benefit there far outweighs the risk. And when it's safe for them to remove those masks because of high vaccination rates or because we have a very low amount of disease in that community, great. I can't wait for that.
At this point, it's not news to point out how early educators are overlooked, underpaid, and undervalued for their work. But as we move forward, perhaps this study will help strengthen the argument to give the sector the financial and material support that it needs.
When I think of the early care and education field, I think of it as an historically exploited workforce, where we know that they will work for far less than what they're worth. And we don't give them what they need in many cases. We entrust upon them the care of our children, and then oftentimes don't give them what they need in order to be able to care for those children well. The measure of a society in terms of how much it truly loves its babies is how well it takes care of those who care for those babies. And by that measure, many of our societies around the world are just not really caring as much for their babies as they should be, because they haven't been keeping this workforce in mind. And this pandemic has highlighted that. This is a pandemic that didn't have profit margins to fall back on in order to be able to get through. When a program had a hit, if they weren't able to get relief pretty quickly from a government, they were going to have to shut down because they didn't have a cushion sitting around to be able to rely on. To think of us as a society entrusting our babies to a system that we've made so fragile because we don't respect the adults who take care of our babies is, to me, just completely unconscionable. And in a large way, that's why we did all of these studies, starting from the very first one, was because of that. It was because of the fact that it was just completely unconscionable to have childcare providers going to work in the middle of a pandemic without even caring to find out what kind of a risk are we asking them to take. So one of the take-home messages that I would hope government can have from this is that When you ask people to make big sacrifices, especially people who are so drastically undercompensated, like our early care and education providers, then it's incumbent upon us to conduct the research, to do the studies, to find out what it is that they need in order to be able to succeed, and give them that.
For the Family Early Years blog, I'm Aaron Hathaway. Thanks for watching.